Also this afternoon, imagine waiting hours and hours at the ER before you finally see a doctor. It's happening right here in Western New York. So what's the holdup? News 4's Brittany Smallwood is breaking down the details of an eye-opening report. Brittany?
Diana, patients say they're tired of waiting for hours in emergency rooms. I've called health officials from ECMC, Kaleida, and Catholic Health Systems this morning. They say they're reviewing the content, so now we're waiting to hear what they have to say.
We were sitting in the ER just waiting. An excruciating pain, sitting there. I just couldn't take it anymore.
Samuel Brown says he waited at Buffalo General for hours last week. He was having complications with his sickle cell anemia. After waiting for 6.5 hours, he went home without help.
I eventually said, I just gotta go. I'd rather be at home in bed than to sit in these awful chairs and just keep waiting.
According to Medicare.gov, the national average wait time before someone is admitted into the ER is 4 hours and 37 minutes. In New York State, that average is 6 hours and 6 minutes. And here's a look at some of the ERs in Buffalo. The longest wait is at ECMC at over 7 hours. Kaleida Health and Mercy Hospitals average over 6 hours. Kenmore Mercy comes the closest to the national average at over 4.5 hours. Teresa Klukowski says she went to the emergency room at Mercy Hospital in South Buffalo. She says she waited 7 hours before being seen.
I couldn't take it anymore. I was sitting there for 7 hours, throwing up in a bucket in their waiting room, and they could not care less. They basically thought that I had the flu, and she told me I had to wait till somebody else that had the flu left. I said, I don't have the flu. I know what's wrong with me.
A spokesperson for Catholic Health Systems says in emergency rooms, people who have the worst illnesses are seen first. They're still reviewing the numbers from Medicare.gov, but they say the numbers don't show the amount of time someone waits in the ER. Instead, it shows the amount of time they wait to be admitted as an inpatient.
The spokesperson from Catholic Health Systems says the wait time for someone to be admitted as an inpatient takes time because those patients need additional tests, and the need when they want a bed, they have to wait for one to be ready. And once again, Catholic Health Systems says they're still reviewing the information before they do an interview. Reporting live in the newsroom, Brittany Smallwood, News 4 at noon.
Thanks, Brittany.